handy dandy patient here. So now I'm going to walk into the patient's room. I'm going to introduce myself. I'm going to do the normal patient identifiers. I'm going to ask them, can you tell me your name, your date of birth, and I'm comparing that with their bracelet, and it should match. I'm going to do hand hygiene, and I'm going to get my gloves on. So I'm going to explain to the patient, hi, Mr. Smith, I have these 2 medications for you. You're due for your Rocephin, which is your antibiotic that's been helping with your pneumonia. And then I also have your Toradol, which has been helping with your pain because you've had all that coughing and stuff. And then we'll discuss specific side effects and everything related with that. We're going to confirm to make sure the patient has no allergies, of course. And then we're going to note the 6 rights of patients. So that's Dr. Tim. So that would be the right dose, the right route, the right time, the right individual, the right medication, and then of course documentation. Because if you don't document, then it wasn't done. So at this point, going into the patient's room, you'll do your 3rd med check. So this is when you would, if you have computer charting, you would scan your patient's badge, you'd scan the medication, and then you would scan your own badge. So you do your 3rd med check, compare the medications with the patient's wristband and the MAR. So when you're going to get ready to give an injection, so this lucky guy gets 2 IM injections at the same time. So I'm not going to give them to him in the same location. You want to always ask your patient, where would you like this? Where did you have it the last time? You don't want to continually give an injection in the same muscle every time because the tissue can harden and that's not very absorbable for the medication. So you want to raise the bed to a working height. You want to try to provide as much privacy as you can for your patient. Cover them with a sheet. Like I said, select an appropriate site where there's no bruising, edema, hardness, or inflammation. We give both IM medications via the Z-Track method. So now that I've done all of my checks, confirmed it with my patient, I'm going to show you how to give a IM injection with a Z-Track method. So when you are getting ready to do a Z-Track method, you're going to need to cleanse your site with alcohol, and then I would recommend loosening your needle cap. So the point of a Z-Track injection is to keep the fluid from draining back out. So we're going to pull the skin to the side. So you're going to just take your patient's skin and you're going to pull it to the side, keeping it kind of taut. And then you want to cleanse the site vigorously, 15 to 30 seconds. And you're going to wait for it to dry. And then you're just going to pick your needle up and we're going to go in at a 90-degree angle. So you're going to tell your patient, okay, there's going to be a big poke. 1, 2, 3. Go in at a 90-degree angle, administer the medication. Wait 10 seconds, and then you're going to withdraw the needle and your hand at the same time. And then you never recap like this. You always either, if it has a syringe protector on it, you do this, or if it doesn't, you just pivot over to the sharps container and throw it away. So you want to make sure the patient's comfortable and check for any allergic reactions, and that would be the same route for the 2nd medication that you give. When you're done, you want to clean up your location. Of course, take your gloves off, hand hygiene, side rails are up, give your patient their call light, and then of course you want to recheck them again in a half hour, 15 to 30 minutes to make sure that they've had any reaction to your medicine that you just gave, any problems with it. And of course, when you give a pain medication, then you have to document that their pain has been improved. So that concludes IM injections.